Welcome to Capital Catch-Up, your deep dive into the inner workings of Congress. I am Victor.
And I am Lenny. Today, we are unpacking a series of significant legislative proposals, starting with healthcare. Let us look at House Bill 9431, also known as the Fair Telehealth Billing Act of 2026. Introduced by Representative Hayes, this bill takes aim at a major pain point for patients, which is separate facility fees for virtual medical consultations.
That is right, Lainey. If you have ever received a telehealth bill and wondered why there was an extra charge for a facility you never actually stepped foot in, this bill is for you. It amends the Employee Retirement Income Security Act of 1974, which we commonly know as ERISA. Under this amendment, if a provider bills independently for their professional services, they cannot tack on a separate facility fee. To keep providers in line, the Secretary of Labor would have the authority to hand out civil monetary penalties of up to $10,000 per violation.
The timeline is also clear here. If passed, these restrictions would kick in on January 1, 2028. It is a direct effort to protect everyday Americans from redundant fees. And while we are on the topic of healthcare access, House Bill 9418, the Access to Innovative Treatments Act of 2026, aims to speed up how Medicare beneficiaries get new treatments.
Yes, this bill addresses what happens when Medicare issues an adverse national coverage determination on drugs or biologicals. It sets up a very strict timeline. Once a review is requested, the Secretary of Health and Human Services must start the review within 90 days, open a 30-day public comment period, and issue a final decision within 120 days after that.
And if that final decision goes against what the advisory committee recommended, the Secretary has to provide a clinical justification. Crucially, the bill prevents Medicare from applying outdated national coverage determinations to newly approved drugs if those old policies would restrict access in a way that contradicts current Food and Drug Administration approvals. It is all about making sure patients do not miss out on cutting-edge therapies due to bureaucratic lag.
We also have two other healthcare bills making moves. First is House Bill 3747, the Accelerating Access to Dementia and Alzheimer's Provider Training, or AADAPT Act. This bipartisan bill was reported with an amendment by the Committee on Energy and Commerce. It reauthorizes the Project ECHO grant program through fiscal year 2031, specifically adding dementia and Alzheimer's care training into the program.
Project ECHO is a great model for spreading specialized medical knowledge to local providers. By amending the Public Health Service Act, this bill helps clinical professionals better manage neurodegenerative diseases. Along those same lines of workforce support, House Bill 2001, the Action for Dental Health Act, was also reported with an amendment. It seeks to reauthorize and increase federal funding to $15 million annually from fiscal years 2026 through 2030 to address critical dental workforce shortages.
Let us also look at House Bill 1493, which is the Bill Pascrell Junior National Program for Traumatic Brain Injury Surveillance and Registries. This bill focuses on modernizing federal initiatives for traumatic brain injuries, or TBIs, through 2030. It directs the Centers for Disease Control and Prevention to expand data collection, especially for high-risk groups like those in specific occupations or individuals affected by domestic violence, and requires that this data be made public.
It also strengthens state and tribal grants by introducing maintenance of effort requirements, which basically means states must maintain their own funding levels to receive federal aid. Plus, it commissions a study on the long-term, chronic health effects of TBIs, including mental health conditions and dementia.
Shifting gears to technology and finance, we have a major bipartisan push with Senate Bill 2528 and its companion, House Bill 4801. Both are titled the Unleashing AI Innovation in Financial Services Act. These bills would establish AI innovation labs within federal financial regulatory agencies.
This is a fascinating regulatory experiment. It allows financial companies to test artificial intelligence under a flexible, temporary regulatory framework. Companies can apply for waivers or modifications of existing regulations under an alternative compliance strategy. This shields them from standard enforcement actions while testing.
But it is not a free-for-all. To get approval, applicants must prove their projects serve the public interest, improve efficiency, and do not pose systemic, national security, or consumer risks. Agencies must maintain strict data security, require annual reports, and they keep the authority to step in if there is fraud or an immediate threat to the financial system.
Speaking of financial regulations, House Bill 9309, the Pride Act of 2026, proposes amending the Dodd-Frank Wall Street Reform and Consumer Protection Act. It would formally expand the federal offices of minority and women inclusion to explicitly include LGBTQI+ individuals. It updates federal language to recognize sexual orientation and gender identity and establishes formal definitions for LGBTQI+ owned businesses to help ensure equitable economic opportunities.
For small business owners, House Bill 5498, the Small Business Health Options Awareness Act of 2026, was reported with an amendment and moved to the Committee of the Whole House. This procedural step means the full House can debate it. The bill directs the Small Business Administration to spread educational resources about individual coverage health reimbursement arrangements, or ICHRAs, working alongside the Treasury, Labor, and Health and Human Services departments.
Another big win for small businesses is House Bill 2804, the Protecting Small Business Competitions Act of 2026. This bill codifies the Rule of Two into the Small Business Act. In federal procurement, the Rule of Two means that for government contracts above the simplified acquisition threshold, the contract must be reserved for small businesses if the contracting officer expects at least two responsible small firms to bid at a fair market price.
That really levels the playing field. Now let us talk about national security and infrastructure. House Bill 7208, the Protect the Grid Act, targets a unique vulnerability: smart household appliances, like electric vehicle chargers and smart thermostats.
It sounds like science fiction, but the concern is very real. The bill warns that foreign adversaries could manipulate these high-wattage, internet-connected devices to cause massive spikes or drops in power demand, potentially causing grid instability or blackouts. It directs the Secretary of Commerce to assess these risks and recommend protective actions like device certifications or supply chain security.
On the energy supply side, House Bill 3843, the Baseload Reliability Protection Act, amends the Federal Power Act. It stops operators from retiring or converting the fuel sources of baseload electric generating units in regions that the North American Electric Reliability Corporation warns are at high risk of supply shortfalls. Operators can petition for exemptions based on safety or financial hardship, but the Federal Energy Regulatory Commission must disregard greenhouse gas emissions when reviewing these petitions.
Interesting. It also allows the Department of Energy to offer grants or loans to keep those plants running. Meanwhile, on the ground, House Bill 9424, the Save Our Pedestrians Act of 2026, would mandate that states spend 5% of their highway safety improvement funds on high-risk pedestrian crossings, working with local governments to identify dangerous locations.
We also saw House Bill 7574, the ELO Realignment and Strategic Engagement Reform Act of 2026. This mandates a major cleanup of the Department of Homeland Security's Engagement Liaison and Outreach Office. The Secretary of Homeland Security must submit a reorganization plan within 120 days to centralize communications and improve info sharing with law enforcement. To force action, the bill freezes the office's staff, budget, and program expansion until that plan is submitted.
Finally, in individual recognitions, House Bill 9595 authorizes the President to posthumously award the Medal of Honor to Sergeant First Class Jorge Otero Barreto for his acts of valor in the Army during the Vietnam War.
Looking at the legislative record, the House of Representatives met for a brief session on July 6, 2026. While the session itself was short, they processed several executive communications, including reports on military actions under the War Powers Resolution, arms export notifications, and financial reports from federal home loan banks.
New legislation was also introduced during that session, covering environmental safety, like banning PFAS in food packaging and cosmetics, plus bills on space security and federal employment reform. Committee reports were also processed, including a proposal to keep the Supreme Court at 9 justices.
As we wrap up, what should our listeners watch out for? Keep an eye on how the Department of Homeland Security responds to the potential freeze in House Bill 7574, and watch for the upcoming House sessions scheduled for July 9th to see if these bills advance further.
That is all for today's Capital Catch-Up. Thank you for listening, and we will see you next time.